Good morning. The WHO Academy was established in an effort to improve and strengthen access to lifelong learning in the health sector, and in particular for health professionals. The importance of upskilling and reskilling health professionals is widely recognized. This is an area in which WHO has, of course, done a lot of work. I mean, for decades, capacity building is one of the main functions of the organization. However, it was felt by establishing a center fully dedicated to lifelong learning for the health sector that will enhance, in fact, the capacities of really meeting and addressing the needs of member states for upskilling and reskilling their workforce. So it was really that search for efficiency, but also for promoting excellence, quality, and relevance in the delivery of training for the health workforce. Well, the Academy, as part of WHO, is meant also to serve and to support WHO in its broad role to provide and contribute to really health for all. So it is really working in close, I would say, cooperation with the technical teams. The program is fully aligned with the broad priority of the organization. So it is really about contributing to supporting member states in improving the quality of health services, and also, increasingly to help them to develop their own capacities for training health workforce. One of the challenges that we see in global health is really the shortage of health workers. We know that according to the projection made by WHO, there will be 11 million health workers actually missing in the world by 2030. So there is a huge gap. Half of this gap will be in Africa. So it means that really building the capacities also of existing workers in the health sector, as well as increasing the capacities of initial training for the sector, is a huge priority. And this is this challenge that the Academy will also try to serve and to address at its best. The role of the Academy is to really provide and contribute to providing access to lifelong learning opportunities for the health workforce, globally. So it has to do with different interventions and forms of engagement for the Academy. The first one is to contribute to really relevant learning materials, and in particular materials to help member states to implement the guidelines issued by WHO. WHO, as a normative organization, does issue a number of guidelines in different areas of public health. This is one of its major functions. However, what we've been observing is that often it takes years, sometimes decades, for actually member states to implement those guidelines. And the lack of a qualified and trained workforce is one of the reasons identified explaining this gap between the publication of new guidelines and their actual application in the health sector. So this is a very important function that the Academy is playing. Another function is really to contribute to broaden the landscape and the opportunities for lifelong learning, not only by producing new content, but also by putting together, facilitating access to contents developed by other entities within WHO, but also with partners. So we are actually developing this lifelong learning ecosystem in health, by establishing partnerships with different institutions, including, I hope, the Imperial College in London, to facilitate building those lifelong learning pathways for health workers that will actually articulate learning opportunities and learning content developed by WHO, as well as other offerings created by partners. So this is another important really line of work moving forward for the Academy. And the third dimension relates to building capacities in member states to actually address themselves, their own needs for upskilling and reskilling. You mentioned low-income countries in particular. So there is a critical need in low-income countries to reinforce also not only the health systems but also the training system for health. And this is something that the WHO Academy will also do by developing not only capacity building interventions for professionals in the health sector, but also to build the capacities of national institutions to develop and enhance their own programs, so that the quality and the availability of training is expanded and improved at national level. The vision for the Academy is really having the WHO Academy at the center of a wide network of learning institutions globally. This learning ecosystem that will create really the environment ensuring that health workers everywhere in the world have free access to content for upskilling and reskilling, and are able to develop their own learning pathways. So we hope that in a few years we would be able to actually establish and gradually even further develop this network of learning institutions and of learning opportunities.